My name is Phil Edwards, and I have plenty of business cards up here, as well as some other things with my information on them. And this is Bethany Clemens is with me, and I've been working with people on Medicare since 1990. I started when I was 10, so but we try to help people, like she said, to see what the most benefits are that you can qualify for. A lot of people are unaware of some of the things that they can qualify for, whether it's extra help or Medicaid, or once having those extra plans that you could get that would give you more benefits that you may not have. Because there's a lot of things that even Medicaid doesn't cover. Things like vision and dental and other things of that nature. So there are plans that you could get that would cover some of those things. But what we were going to do, first of all, was just talk about how Medicare works with these plans. And I'm sure y'all are obviously somewhat familiar with Medicare already, having been on it. But just wanted to cover some of those basics here. So I don't know how, in the back there, how well y'all can see this. Probably not well at all.
No.
Okay. Basically, this chart here is talking about some of the differences between original Medicare and Medicare Advantage plans. And this is actually right off the Medicare website. It's not from any insurance company. So it talks about original Medicare, which includes your Part A, your Part B. So Part A, of course, is what covers the hospital. Part B is what covers the doctor in or out of the hospital. And so then you have coinsurances or deductibles with Part A and B of Medicare. And then it mentions down there below that you can add, you should add Part D. Hopefully everyone that's qualified for Medicare does have Part D. If you don't take Part D when you are eligible for it, then there's a penalty if you get it later that's permanent, unless you get signed up for extra help, and that would eliminate that penalty. So I've had some people too that I ran into that didn't feel like they could afford Part D, but they actually qualified for extra help, and so that eliminates having to pay a premium or pay a penalty.
Now, Phil, explain for my sake what Part D is, what it covers.
So Part D is what covers your prescriptions.
Okay.
Yeah.
That's your drug.
Yeah, so that's going to be included if you get a Medicare Advantage plan. It would be included in the plan, but if you just have original Medicare and a supplement, or just Medicare by itself, you can have a drug plan separately to pay for those prescription costs.
And that's where I want to jump in here to explain further. A lot of people run into problems. If you took out, or about to take out, Medicare, and you're thinking, I'm going to save money with Medicare by not paying a Part D premium, if you don't sign up for that, you are, as he said, you're going to be in a mess later on. You know, you want to make sure you have A, B, and D.
Yep.
Correct? Okay.
Yes, ma'am.
There are some other alphabets in there, but I don't worry so much about them. You want to make sure that all of you right now have A, B, and D. If you don't, we need to be working with you. And I will tell you, it's my phone, y'all just ignore it. I'll tell you, even though I do this, I try to help people and monitor, even people very close to me have made mistakes because they thought they knew what they were doing and they didn't say, hey sis, my own brother made this mistake and got himself. So now he's penalized because he needs to take out Part D. He did not take it out originally. So he's got himself in a mess. So you've got to make sure you know this stuff and listen to people like this.
What is the penalty for that?
So the penalty is it's a financial penalty. It's 1% of the national average premium for Part D. So the national average premium for a Part D plan is about $32 a month. So 1% of that, about 32 cents per month, is assessed. So let's say you went 3 years before you signed up. That's 36 months times that. So you're looking at a penalty of around $10, $12 a month for the rest of the time. Now, if that national average premium goes up, then your penalty would grow. It actually went down a little bit this year. So, but the longer you wait, the bigger that premium accrues to it, and that's not something the insurance company gets. They collect it, but they give it to Medicare. So it's just.
And it's real hard to understand, to wrap your head around, but you really need to talk to somebody. Don't just. People will say, well, I went online and so-and-so helped me and we went through the Medicare site, so we're sure it's right. Well, no, that Medicare site's not gonna reach out and grab you and shake you and say, hey, you gotta do the Part B here, you know? Also, another glitch you need to be aware of is, see, I wasn't aware of this until we went through this with my husband. If you're gonna take out a supplement plan, you have to do that when you turn 65, correct? After 65, you can't?
No, well, you can, but if you have any health issues, you have a 6-month open enrollment window there when you turn 65 where there's no health questions. So if you wait after that, then there's underwriting. So if you have a supplement that's gone way up in price and you can change, but you have to look for somebody that will accept you with the health conditions you have.
That's what it was. If you're 65 and you have the opportunity and you can afford a supplement plan, what a supplement does is come in and pay everything that your Medicare doesn't pay. You pay a premium for it. But if you don't do it when you turn 65, as your health declines, the amount goes up ridiculously.
Yeah, it's higher.
Yeah.
So the other thing is too, though, that if you're low income, if you're getting extra help from the government, your SLMB, QMB, then really there's probably a Medicare Advantage plan that'd be a better fit than the supplement. So.
Let me see what it's now.
So the other side of this chart here talks about Medicare Advantage, and that's called Part C of Medicare. You have A and B are original Medicare. Part D is the drug plan. Part C is Advantage plans, which typically will include the drug plan. But basically it says Medicare Advantage plans are all-in-one alternatives to original Medicare, which bundle A, B, and D together. So for instance, with Part A, if you were just on original Medicare, you have a $1,408 deductible if you go to the hospital for one night or up to 60 nights. You have a $198 calendar year deductible with Part B. The $1,408 is actually each time you go to the hospital. So when you're on a Medicare Advantage plan, you don't have those deductibles. You don't have the separate bill from the doctor and the hospital. Everything is all together, so you just have the one copay the plan has, and then it pays everything else. So in that sense, it's simpler. Use that one card instead of a supplement card, a drug card, and a Medicare card. Use a card from the insurance company for that.
Let me ask, does anybody here have just Medicare?
No, Medicare.
We're gonna talk about that. Now, Dennis, do you have straight Medicare?
I don't think we ain't got the D, have we?
Yeah.
Okay.
I would have to. but they say
Nobody here has straight Medicare. By straight Medicare, I mean you don't have an Advantage plan.
When you go to the doctor, you use your red, white, and blue card.
That's all you have. Okay, so we may need to talk to Miss Vivian then. Okay, I just wanted to open that up, find out who has what, and if, we need to be targeting you to help you, okay? All right, let's listen to Mr. Phil.
Okay. So it mentions here that most plans are going to include not only your drugs, but extra benefits. So those extra benefits can include things like dental, vision, maybe transportation. There are different benefits with different plans in different counties, but there are things that are included there that you wouldn't necessarily get, whether you have Medicare, Medicare and a supplement, or Medicare and Medicaid. There's things that those things don't cover that the insurance plan would give you. So those are things a lot of people we talk to are interested in. Some of the differences between original Medicare and Medicare Advantage. So of course with original Medicare, you can go to any doctor that takes Medicare, which most do. With most Advantage plans, they are network plans, so they're either HMO or PPO plans, so you use the doctor in network. There are also, though, in our area, some plans that are called regional PPO, and with a regional PPO, you can go in or out of network, the same cost. There's no difference. You just, as long as the doctor is willing to bill your plan, you can go to them. So that makes it real simple. So the out-of-pocket costs are going to vary according to which plan you go with. And if you have Medicaid, you're not adding any costs. If you had Medicaid, the plan is going to be, if you're paying zero now for everything, you're going to pay zero for everything with that. The difference would be the extra benefits that you would get with it. But if you're on original Medicare, whether you have a supplement or just original Medicare by itself, you have co-pays and co-insurance with Medicare. The supplement may pick those up for you depending upon which plan you've got. And we run into people that are paying anywhere from $100 a month to, I had a lady the other day that I wrote she was paying $446 a month for a supplement and a drug plan. So, amazing. There's a lot.
She didn't know that she didn't have to do that.
So we saved her a lot of money. So there's a big difference between plans and what you can do there. But the supplement is what it's supposed to cover. It says with Part B, you have 20% of the Medicare approved amount. You have a premium for Medicare, like she mentioned, it's $144.60 unless your income's higher, or if your income's lower, the state may pay that for you. Otherwise, everybody's paying $144.60. Now, what she was talking about, it was different for different people for a while. When in the years when there's not a Social Security check increase that's enough to cover a premium increase, the government has what they call a hold harmless provision, which says they won't raise your Medicare premium more than your check goes up. So during those years, we found people paying different Medicare premiums, but the last couple of years, the increase has been high enough to cover the Medicare premium, so everyone's paying the same now, unless you have extra help covering it. There's no yearly limit on what you can pay out of pocket, so if you only have original Medicare, the sky's the limit what you could owe. That's why everyone should have either a supplement or an advantage plan, because it limits your financial risk. With just Medicare, that if you have a 20% of $1 million claim would be a lot, right? There is no cap on what you can owe. And so you can get the supplement to pay those things for you. But on the other hand, with the Advantage plan, there's an out-of-pocket limit for the year. There's also an out-of-pocket limit per hospital stay, per treatment for a lot of things. So it limits your financial risk that way. And you can't, it says at the bottom there, you can't buy or use a supplement with an Advantage plan. So we don't run into that too often, but Medicare supplement doesn't work with a Medicare Advantage plan. You have one or the other. You wouldn't want to pay for both because it's different. Okay. So original Medicare is going to cover medically necessary services in supplies in doctor's offices and other healthcare settings. On the other side of the column there, it says Medicare Advantage plans must cover all medically necessary services that original Medicare covers. So if you were to change to a Medicare Advantage plan, you don't lose any benefits. Medicare Advantage plans are contractually obligated to cover anything Medicare would cover, with one exception, that's hospice care. Original Medicare continues to cover hospice care even if you're on an Advantage plan, but anything else that Medicare covers is covered by an Advantage plan, so you never have to worry about losing coverage that way. Actually, like it says, you may get extra benefits that original Medicare doesn't cover, like vision, hearing, and dental, and more. And then again, the drug coverage is going to be included in those things. So, do some of you have Medicare Advantage plans now? You do have? Okay. So,
Some of you have Medicare. Some of them are not sure what they have.
yeah, that's a Medicare Advantage plan.
I'm not sure. Yeah, I think you have an Advantage plan. Yes, you okay.
Okay.
Yeah.
So what
Okay,
kind
so
you
we're
say
gonna
was
talk
better?
about that.
Well, no, the Advantage or supplement?
What's that?
Well, ago you said.
Okay.
Advantage or the supplement was
Yours
better.
is a supplement.
Well, they're different. So I'm not going to say one's better than the other. They're different. But now, if for instance, a person is lower income, really to pay for a supplement, $200-300 a month would probably not be a good idea. An Advantage plan for little or no premium would give you control of your medical costs.
So one Advantage.
But they're just two totally different things. Some people have more of a comfort level with one than the other. She was asking me if Medicare Advantage or Medicare Supplement is better. And I always tell people that it's kind of like if you go to the grocery store and you get a gallon of milk and a loaf of bread, and you get up there and they say, hey, that's going to be $500 because we know you're going to want more later. Who here would want to do that, right? You want to pay for what you get now.
Yeah.
So the Advantage plan is kind of like that. You're paying little or no premium for it. You have a copay when you use a service. The supplement is more like I'm prepaying. I'm paying this premium so I don't have to pay later. So it's just really two different philosophies. If your income is where you are able to afford it, then it's just which one do you like better? But a lot of people, really, the Advantage plan does work out better because of economics and just comfort level with
Let
it.
me ask this now, Phil. Typically, a person who could afford a supplement plan would not qualify for Medicaid QMD.
No.
They would qualify for an Advantage plan and could get an Advantage plan, but you wouldn't typically have, be able to afford. Like, I'm gonna use Pat here for instance. Pat, like my husband, her income and earnings is over amount that she does not qualify to receive Medicare. You just over that income guideline a little bit. But she doesn't, she looks at her age and looks at her health, and she doesn't want to be hit by a catastrophic illness down the road here a year from now. So she can afford to, and took out with Phil, a supplement plan. So she has her straight Medicare with her supplement, which prevents her from having to pay any co-pays. She doesn't pay for anything but her premium, her monthly premium. But see, most of you are not going to qualify for that because your income is going to be under probably the guidelines. Those of you who are single grandparents, Pat had real estate and savings and work and money put away, and so she has a different income level. Y'all might want to be working the room. Income's a little higher. Martha, you better hang on to your man. James, I need to call your wife. Okay, now listen up here. We'll get straight on the difference. I want you to know the difference in a supplement, Advantage, and straight Medicare, and what Medicaid is.
Now, you may have heard a lot of advertising, of course, back in the fall for Medicare Advantage plans. That's when most people, anyone can enroll then. Anyone can change drug plans or change Advantage plans in the fall. But there are still other opportunities when people can change with their plan. So you have the initial enrollment period when you first get on Medicare, or if you're on Medicare disability, when you turn 65, you can also make another election there or get a supplement. You have that annual election period that's every year from October 15th through December 7th. But then there's an open enrollment period, and that open enrollment period only applies to people who are already on an Advantage plan. They can make a change from January 1st through March 31st. But there's also opportunity for people if they have a chronic illness. We have certain plans that if you're diabetic or have heart or circulatory issues, you can qualify for one of those any time of year. And there's also, if you get extra help, whether it's just extra help with prescriptions or Medicaid in SLMB or QMB levels, that you could make a change at any time of year as well, once a quarter actually. So there are other opportunities to make a change. The other thing this mentions here is that if you move out of the planned service area, so if you move from here to Catoosa County or from Catoosa County to here, those are considered two different service areas. You could change plans and moved out of state, whatever. There's a lot of things, places moving would make a difference for you as well. So, the other question we get a lot, it mentions here, what if I have a pre-existing condition? So because this is a contract with Medicare, unlike other insurance, there is no pre-existing waiting period. If you're on an Advantage plan, you change to another one. If you're on a supplement and change to an Advantage plan, Advantage plans are a contract with Medicare. They have to cover what Medicare covers, so there is no waiting period. You don't have to worry about any pre-existing conditions if you do change plans. And again, during these changes, the SEP or a special enrollment period, you can only make one change per quarter. So if you change to a plan and you hate it, you got to wait to the next quarter to change. But that's only 3 months, right? The other thing that it mentions here, there's one health condition that says, can I join a Medicare Advantage plan if I have end-stage renal disease? That is the only health condition that would prevent you from getting a Medicare Advantage plan. So if you're, like I say, if you have heart problems, emphysema, cancer, whatever, you can get an Advantage plan. You just can't join if you have end-stage renal disease. In other words, dialysis.
We don't have anybody on dialysis.
Okay. All right. So there are HMO and PPO plans, like we mentioned. The private fee-for-service isn't really much in our area anymore. But then the special needs plan, so touched on those briefly, but here the Medicare, this is all from the Medicare website, but Medicare talks about special needs plans provide benefits and services to people with specific diseases, healthcare needs, or limited income. So special needs plans are designed for people that are dually eligible for Medicare and Medicaid, or people who have certain chronic illnesses. So with most insurance, if you got a heart problem, well, you can't get it. But with the chronic illness plan, you have to have the heart problem or have the diabetes to qualify for the plan. So that does give you some options there. All right, and then it does again ask here, can I get my health care from any doctor, healthcare provider, or hospital? And so again, generally, most plans are network plans, but especially like if you lived in Chattanooga, all those plans up there are pretty much either HMO or PPO, where you have to go in network. But we do have kind of a unique thing in Whitfield County. We've got a couple companies that offer regional PPO plans where if you were to go, you can go in or out of network and there's no difference in cost to you. So that's a nice opportunity. All right, this talks about MSAs. We don't really have those. Now, I know she mentioned one lady back there has a supplement. Does anybody else have a supplement? You do? Okay. So, of course, Medicare supplements, universally, usually when I talk to people who have a supplement, everybody always says, it's great, it pays all my bills. Contractually, they have to. Medicare says they pay this much, they have to pay the rest. The only complaint we ever see from people about their supplement is how high it's gotten. So, like this lady I wrote the other day, she told me when it was $394, she thought that was a lot, but she was okay with it. But when it went up to $446, that was it.
I started out to buy $120 a month.
What do you pay now, James? 144.
Okay.
That's been 3 years.
Yeah.
Okay. Yeah.
It
So
goes up a little every year.
yeah, that's not too bad.
No.
It's usually after you've had them several years, they start
It'll
jumping on you.
climb.
I've
It'll
got a
climb.
deductible on that too. I have to pay.
You're on Plan G?
Yes, for
The Plan G where you have to pay the $198?
I think it's about $180.
Yeah.
I think I like with that.
$198, yeah. It's a Part B deductible.
I don't know what's in the supplement.
Yeah. Yeah.
Now,
So
what is that, James?
Part B deductible, if you have Plan G, it pays everything but the Part B deductible.
Okay.
And the Part B deductible this year went from $185 to $198.
I'd rather pay that deductible, pay my doctor bills, pay my hospital bills.
Yeah.
But now, that's a supplement, right?
Yes.
So the supplement is called the G.
That's the one that we sell the most of right now. But yeah, there's
I was trying to figure out what's a part G. These alphabets are
Year.
yeah. Huh?
I have mine a year.
New Era, okay. Yeah. So Plan F is what most people used to buy, and for years everybody said, I want F. The only difference between F and G is that F pays the Part B deductible, G does not. So the premium difference is usually enough that you're better off paying the Part B deductible yourself. Would you give me $400 to run down the street and pay a $198 bill for you? Probably not. That's really what you're doing, and most of the time to go from to Plan F instead of Plan G. So that's why more and more we see people go to Plan G. And the other thing is the government also changed it January 1st of this year. If somebody turns 65 after January 1st, they're no longer eligible to buy a Plan F, because basically the government wanted you to have a little bit of cost sharing. So by going to a Plan G, there is that little bit of cost sharing at least. So this mentions here getting more information from Medicare Plan Finder. Medicare Plan Finder, you go to medicare.gov and there's a tool there that helps you look at Medicare Advantage plans and drug plans. the great thing about what the government did in their ultimate wisdom, they thought it needed improving, and so they made it much more complicated to use this year.
Ain't they just like the government? They're
So-
got it figured out. They're gonna get through.
Even as agents, we look at it and go, wow, you know. So definitely, I think a lot of times people more so now need to work with somebody like us that's familiar with the plans instead of just going to the Medicare site, because they really made it a lot more difficult this year to understand what you're looking at there with the plans. So
Have
what?
any of you ever done that and gone to the Medicare site where they try to direct you or give you go in there and you put in your illnesses and what your health is and you put in your prescription drugs and all that? Has anybody tried to do that? First of all, it's impossible when all you own is a smartphone, you know? So,
It's harder.
it's, yeah, ridiculous.
The other thing is that I've had people tell me that they get the Medicare new book, and of course it's different for each state, so it'll have the plans available in your state, and they'll look and they see a plan that looks awesome, they're like, that's what I want. And I look at it and I go, well, that's not for sale in your county.
Yeah,
So it's not that simple.
yeah, it's not
So,
simple.
but so anyway, what we do is we are familiar and contracted with all the plans that are available here. We don't just sell one. We don't try to put a square peg in a round hole. You know, we try to look at your situation, who your doctors are, what your prescriptions are. Do you have extra help, or would you qualify for extra help? And we can help you to sign up for that. But we want to try to help you to get something to give you the most benefits for the least money. So, if anyone is interested in talking to us later, we would love to do that with see if we can find out if there's anything more that would help you. And we don't twist any arms. We just show you what's available.
Just break legs.
Yeah. So. I'm going to give y'all, I think I brought enough in. If I didn't, I've got a bunch more in the car. I'm going to give y'all my business card. Y'all together? Okay.
Any questions?
Okay. All right. You're not. Just somebody there.
Phil, you are gonna eat lunch with us, right? We're gonna have a chat and talk and eat and drink.
Okay. I didn't think about that, but. And I've also got up here, anybody wants them, I've got these, they're jar grippers, makes it easier to open your jars. Women love those. So. And I've got a few of these bag clips too,
Now, these ladies down here, Phil, we need to get y'all together and have
All right.
especially these two. Okay?
Absolutely.
Because I'm most concerned about both of their insurance. Now, those of you I know are gonna have questions who are, drawing disability. But with those of you who are drawing disability, but not yet 65, they're better off having an Advantage plan. So James, do you have an Advantage plan? Do you have Medicare? Come over there. Let me see what you guys have now. Just a minute. Now, James, what do you have now?
anything back for
Joyce, it's coming, honey. 21 or 20 or.
She just changed it. Sarah's gone around there to talk to them. It's up to 25 now.
So I can tell her 25?
Yeah, she's back there telling them already.
Okay.
I sent her back. So it's making a 20, comes in all,
So, did you continue?